there was a little change in the schedule. Our next speaker will be Dr. Haitham Osama Khalifa. He's an emergency medicine physician, very active emergency physician in Egypt, and he will be talking about the emergency physician burnout.
Hello. Working? Yeah. I am Haitham Khalifa. I am emergency specialist at Sheikh Zayed Specialized Hospital, and I am a member of Egyptian Society of Emergency Medicine and operational manager of Sunu School. I want to thank Dr. Bashar, Dr. Errol, Dr. Behjit, and all EPAC for this outstanding organization and invitation. I'm going to talk about emergency physician burnout. So, do you feel stressed today more than before? Do you feel that you are angry, frustrated, or you think to give up your profession? Did you fail to relieve your stress in the emergency department? As an emergency specialist, I know that it's very difficult to feel calm and feel relaxed while we are working in the emergency department. We have a lot of challenges, we have a lot of stress, but we all suffer from this, maybe silently, but also we have we should be relaxed, and we should be satisfied and happy in our job. Okay? The good news for all of us that we can fight emergency burnout. So, what is the difference between stress and burnout? Stress, it means that you can recover and you can charge your batteries, you can go to work again. Burnout, it means that you can't charge your batteries and you can't do your job and you can't be enthusiastic while doing your job. This is some ways we do to relieve stress in our emergency department in Egypt. We are working too many hours, so we meet and we eat. We do some PlayStation games, maybe sometimes, some coffee, cigarette smoking. So the best example to understand what is burnout. It's like when you go to the bank, you don't put money, you put energy. And in my opinion, this energy of three components. It's a physical energy, it's emotional energy, and spiritual energy. Physical energy, it means that you come up early and go to work. Emotional energy, that you have emotional behavior toward your patient. And spiritual energy, it means that you are connected to your purpose of work, you are connected to your why you are doing this job. Every day you take from your energy. Every day you take from your energy. And for emergency physician, we are operating on the negative balance. So, the question here, are you at risk? Sure. Emergency physician, 65% risk of physician burnout, internist 55, GB 26.8. We are less aware of the burnout. So, what are the symptoms of the burnout? Symptom of the burnout is exhaustion. You feel that you are tired, you are worn out, you can't do your job. Depersonalization, it means that you are dealing with your patients in a negative way. You have a negative attitude toward your patient. You are sarcastic toward your patient. Doubt, you are not confident in your job, and you lost your belief in your job and what you are doing. You lost the meaning and the value of your job. So it's very important to charge your energetic batteries in between work. To know which level of burnout, there is a Maslach inventory. It is the three phases. The okay phase, you are asymptomatic, but you are exposed to stress and burnout day and after day. The second level is phase 2A. In phase A, you are symptomatic. Some of the days you feel that you are burned out. 2B, most of the days you feel that you are burned out. Stage C, that you don't remember the time you were enthusiastic and doing your job with a full strength and full power. If you came to the third stage, the phase of danger, Here you are about to quit your job and to quit your emergency physician job. In this phase, you may be in danger to depression, to drug addict, to problems in your life, in your family, in your marriage. So please take care of this phase of burnout. The good news that we can fight the burnout. Let's imagine that you are in a boxing stage, you are ready to fight the burnout. It's a very small enemy, but unfortunately you found all the audience and all the trainer, all the coaches with the emergency burnout. So what are those factors that fight and help the burnout? One factor that you are a doctor, you have a lot of responsibilities, you are dealing with sick patients and they need emotionally support. Also, you have some financial problems. Who is paying for you? You are not doing a business. Also, lack of leadership. In our job, you must be a leader and you are not trained to be a leader. You find yourself a leader in your emergency department. Also the medico-legal issues, the capacity issues, the low resources, paperwork, too much paperwork. You are in the front lines always and too much hours, you are working too much hours. Other specialties sometimes don't help you. Social awareness and variety, you are dealing with different specialties and with different patients. So, what are the cure for the emergency physician burnout? It is the 3 R. The first R is to resist. It is a very important step in the cure of the burnout. To resist, it means it's like the shield in the battle. It means that you are the eye of the storm rather than to be enemy of the burnout. It means that you detect the stress when you are in the emergency department. You try to relieve this stress. You try to remember the purpose why you are working. You try to remember that you are hardworking and you are very intelligent and you are doing a great job. Your families love you and you have a lot of activities. So the first and most important is to resist when you feel the burnout. The second step here is to restore. Restore, it means when you get out of the job, please try to recharge your batteries. Try to do what you love, sleep, eat, relations, and go out, travel. You try always to restore your batteries. The third point here is to reduce the exposure. How to reduce the exposure? To reduce the exposure, you can make some groups that detect the problems of the burnout in your emergency department and try to solve these problems. You make clear protocols for admission and for dealing with other departments. You make a training of leadership and management in your emergency. You plan for the capacity issue and you find solution for the low resources. You can do but less. It means that to reduce the hours of the shift and to reduce the long shifts. Also, you can change the position. Like residents, we can do some shift to other departments like anesthesia, like ICU. This may relieve some stress of the emergency department. So, my take-home message to the emergency institute and hospitals: if one emergency physician burned out, it costs about $100,000 to make a perfect emergency physician. Also, you will increase the medical errors and malpractice. You will lower the patient satisfaction when you reach the emergency physician burnout. And my message to all of us and to emergency physician: please keep your eye on the burning out. Try to resist, to restore, and try to reduce exposure. Thank you. Any questions?
Anyone who wants to inquire about anything about avoiding burnout? Yes, please.
Thank you for the wonderful lecture and the solutions. I think burnout is a global problem, and in our country we have, as stated by Dr. Srinath yesterday, that we have requirement of at least 50,000 emergency physicians, and the very few we have are burning out.
Yes.
Okay, so for a developing country who are, a lot of young emergency physicians,
Yes.
what is your advice to reduce burnout?
Yeah, sorry, again, I don't...
For young emergency physicians,
Yes.
what is your advice to reduce burnout?
Yes, as we said, it is the role of the hospital, the department, and the role of the physician. The first rule of the physician is to resist. You are doing too much work and you didn't know that you are burning out. You must resist. You must see what are the causes of burnout and talk to your manager, talk to your friends. What are the causes? Some hospital may be some security issues that make the stress on you. In other hospital, it may be the paperwork. In other hospital, it may be the connections with the other department and the admission to the ICU. So try to resist, try to consider this problem, and try to think about it. Also between shifts, try to make what helps you and try to enjoy your time. Also rotation with other departments may relieve the stress for the residents in some times. I think that...
Yes, please. Where is that?
Dr. Khalifa, thank you very much for this important issue. I think it's really a really important issue among the emergency physicians. As you said, it is mostly found among the emergency physicians. So just I want to share an addition or suggestion. I think the emergency physician or the person who are, all staff who are working ED, they need to have an examination every year for the burnout.
Examinations?
Yeah, they need to have an examination, have complete examination about if they have or not, and to learn the level of the burnout.
Yes, it's very nice idea to detect his level of burnout. Is he stressed? Is he okay? Because in one time you can find that he reached the third stage or the third phase in the burnout and he's quitting his job as an emergency physician.
Dear Doctor, thank you for, first of all, because your presentation was good, you were well prepared, and you were active on the stage. So I'd like to thank you again. This is Dr. Furkan speaking from Atatürk University in Erzurum. I'd like to ask about, you told, 3 signs of burnout, like exhaustion, and then to quitting the job. This great horizon, seems like that. And it's like the depression, clinical depression actually, because it begins with the anhedonia to the suicide, right? It's a kind of depression, but majorly in workplace. So are there any clinical trials with the medication, antidepressants, for the burnout treatment? Or should we show some interest for medication to the burnout or overstressed doctors? Thank you.
Yeah. Thank you for your question. And as we discussed, you may reach to the depression, you may reach to the suicide, you may reach to medication, to addict. So at this stage you may need the psychiatric consultation. So the best thing in this problem is to detect early, try to manage early, and I think if you reach it to the depression stage, you have to take a consultation of psychiatric, and you may need antidepressant, something like that. Any other question?
Thank you so much. We'll have a break for 10 minutes, and then we'll come to Satellite Symposium.